Dr. Coachman, it's a great pleasure to have you here today, and we are very happy that you are here to share your clinical perspectives with us. So what are the major skills that need to be mastered in order to achieve clinical excellence in aesthetic dentistry?
I think it's a complex question. We need to have many different skills to be able to get the best and exceed the patient's expectation. Of course, we need to control the basics. We need to control biology, function, and structure. But nowadays, most of all, we need to understand about aesthetics. And this is sometimes a problem because in many situations we don't have the proper training when it comes to aesthetics. We cannot only be a dentist nowadays, we have to also be a kind of a dentist artist, to be a designer, actually, to be a smile designer.
From a biomechanical standpoint, is it advantageous to use ceramic or composite materials in the anterior part of the mouth?
I think to have the best answer, we need to not only analyze biomechanics, but analyze many other factors. If you're going to select a composite or a ceramic material or a direct or indirect restoration, you also have to analyze the occlusion, the diet, financial issues, to give different options to the patient. When it comes to anterior restorations, nowadays composite materials are really increasing their quality, and you have dentists doing amazing direct restorations with composite, and I think there's a very good option because it's less expensive for the patient, and you can achieve very nice results. The key is to make the patient understand that the longevity will not be as the same as the ceramics. But in terms of aesthetics, we are getting nice results with direct composite. But still, for me, the best anterior restoration is still made out of ceramics.
In your opinion, what clinical factors determine the use of a direct versus an indirect restoration in the anterior region?
I think that there's two main advantages of doing direct restorations. Is the less cost for the patient and less time of treatment for the patient. On the other hand, usually indirect restorations, they last longer and they have better aesthetic properties. But above all, I think it's more related to the skills of the professionals that are working. We see amazing dentists doing amazing direct restorations, many times better than indirect restoration that comes from a lab. And in other times we see amazing technicians doing amazing indirect restorations that are better than the average direct restoration that a dentist would do. So it's a matter of how do you manage your skills and how do you train yourself to do what you want to do the best. But for sure, again, I think the indirect restorations are still giving a little better aesthetics and a little better restorations in terms of longevity. But the cost, again, is something that it's really trend now to analyze that, and in Brazil it's a very big, it's very common to have dentists doing direct restorations because of this factor. Clinically, I think the main factor is the shape of the prep and the shape of the defect. What kind of restoration are you doing? The size of the restoration, occlusal issues involved. So usually if you have a small restoration, you can easily do it in direct composite. But if you have a full buccal reconstruction, I definitely prefer to do it in ceramics, indirectly with ceramics. You can also do a combination, and sometimes you can utilize the composite restoration, the direct restoration as a trial, as a long-term provisional, as a blueprint, and then do the final ceramic restoration following this design that was done in composite.
Unfortunately, we are all experiencing the global economic crisis in different degrees. How challenging do you think is to maintain integrity and quality in our daily practice?
That's a very good question. I think nowadays dentists all around the globe, and we see that because we're traveling a lot, and everywhere we see people, dentists, suffering from the crisis and complaining about the decrease of the amount of patients. And so it's a tough moment for everybody. And unfortunately, when we have financial issues, we have the tendency to try to solve it in a way that will decrease the quality. So sometimes we want to do things faster, to be able to charge less and keep the same income. Sometimes we want to utilize cheaper materials for the same reason. But I think our challenge is to keep up and take in consideration the ethics that are involved, and focus on your work and do the best you can. And I think always the best solution when we are going through a problem is to always do the best you can and forget a little bit about these issues, keep the quality, and I think you're gonna have this working in your favor. Because what I see is that the high quality dentists, they're suffering much less with the crisis than the average dentist. So the goal should always be to become a better professional, because what I see is that these professionals are not having that much trouble. I think nowadays it's very important for you to invest in your image. It's like in any business, marketing is important. And so when you're during a crisis, we all know from big companies that that's the moment to invest in your brand, invest in your name, and promote yourself, because when the economy takes off again, you'll be at the top. So as a dentist, we have to understand that PR is very important. You have to be good with people. You have to be good with the patients on this side. So that will bring the patients to you, even if you cannot charge that much now, but this will reflect in a positive way in the near future. So you have to invest on new techniques, on new ways to communicate with the patient, on new technology. I think this is the moment to invest in technology, and dentistry is getting into technology very strongly. So I think that's the moment to invest, because when the economy starts growing again, these dentists will be at the front side.
What future technological innovations do you foresee in the upcoming years?
As I mentioned, there's a very technological moment for dentistry. If you go to meetings like IDS, you'll see the number of digital technologies that are coming to our field, and we cannot do the same kind of dentistry that we were doing 10, 20 years ago. We have to accept this new reality, either on the clinical side or in the lab side. CAD/CAM technology is huge and is changing completely the laboratories. So nowadays we can do a restoration from A to Z utilizing digital technology, from a digital impression, digital softwares to design restorations, softwares to design frameworks, then the CAD/CAM, the milling machines to mill these restorations even chair-side in a very fast way. And when this technology started, we had a lack of aesthetics and precision. But the technology is improving the quality very fast. So we are also achieving nowadays nice aesthetics and nice precision with CAD/CAM systems. So I think it's going to take over dentistry in a couple years. and so we have to adapt, we have to accept, and we have to become also digital smile designers to be able to handle those machines and to utilize them in our favor.
Finally, what do you consider to be the state of the art in ceramics?
I think that's an interesting question. Depends on the point of view. You have the dentist, you have the technician, you have the patient. Of course, as a ceramist, we try to look to the details, and we think that layering from scratch and building in details of internal characterizations, opalescence, fluorescence, so the old school layering technique, it's probably with feldspatic ceramics, it's probably still the state of the art. But for the dentist, it's more about a technique that will give him decent aesthetics and decent profit also. And then for the patient, is much more about the design. And sometimes we see cases that were done in a very simple technique, like a pressable monolithic anterior restoration with no internal characterization. And because shape and the design is good, the shape is good, the patient is really, really happy. And of course the value. So I think state of the art for the patient is a restoration that has a good value with the color that the patient wants, nice shape, and a nice smile design that fits the patient's face and fits the patient inner and emotional aspects. And so as a ceramist, we have to focus a little bit less on the details and focus more on how we design and the overall look of our restorations, and understand how to integrate these restorations with the face and the emotional aspects of the patient.
Dr. Coachman, it was a great pleasure of having you here. Thank you very much for your time.
It's my pleasure.